Hello, my name is Nick and I'm going to be performing a physical assessment on a stuffed animal today. So before I begin, we checked the patient's vital signs and there were no abnormal test values. Every test value was in range. We also checked the patient's visual performance examination using a Snellen chart, and the patient recorded a 20 out of 20, meaning that they could read every letter on the 20 out of 20 line and not every letter on the line below that. So now I will begin. Knock, knock. Hello, my name is Nick and I'll be your nurse today. Can I start by having your full name and date of birth? Okay, and can you tell me why you are here? Yes, and where are you right now? All right, who is the President of the United States? And what time is it? Okay, patient is ANO times 4. All right, so can you tell me what kind of allergies you have to any medications, any food, any environment? No allergies. All right, so can you tell me what kind of mood you woke up in today? Happy? Are you always happy? Yes. Okay, that's good. Do you have any pain today? No? Great. So I'm going to ask you about your most recent bowel movement. When was that? This morning. Okay, and what was the color and the consistency? And when you urinate, how frequently do you urinate? Okay, and is there any burning, pain, abnormal, stinging, anything of that nature? Any itching? No? Okay, so color is yellow. That's good. Okay, so now before I go any further, I'm gonna have to touch you. Do I have consent to do so? Yes, great, thank you. All right, sanitize hands, grab the pen light. Pen light on, lifting the auricle up and back. I'm gonna check the patient's ear. Minimal cerumen present. Ear canal is pink and the outer ear is free of any drainage. Lifting the auricle up and back, ear canal is pink, minimal cerumen present, and the outer ear is free of drainage. So while I'm here, I'm going to do a whisper test. Go ahead and tell me whatever I whisper into your ear. Red, red, blue, blue. Okay, correct. So the patient passed the whisper test. Now I'm going to check the eyes. So before I begin, are your eyes sensitive to light? No history, seizures, anything like that. Okay, good. So pen light on, I'm going to check for direct pupillary response. Pupil constricted. Pen light on, pupil constricted. Now I'm going to check for consensual pupillary response. Pen light on. Okay. Pen light on. Okay. Pupil's constricted, and now I'm going to stand 12 to 18 inches away from the patient. And I'm going to ask you to follow my pen. Okay, and follow the pen as I bring it toward your face. Okay, pupils equal around, reacting to light and accommodate. Okay, now I'm going to check the nose for any drainage. No. Okay, we'll perform a smell test. Can you smell anything? Yes, it smells like aloe vera Vaseline? Correct. Okay, so now I'm going to ask you to smile for me, please. Thank you. Stick out your tongue, go side to side like this, and up and down. There you go. And now let's shrug your shoulders, please. Using your trapezius muscle, bring your shoulders up. There you go, thank you. Okay, now open wide, please. All right, pen light on. Frenulum is midline. Tonsils grade 1, oral mucosa pink and moist, and no masses, lesions, scars, any abnormal features in the mouth. Okay, I'm going to check your jugular vein distension now. So sitting at a 45-degree angle, can you turn your head to the left, please? Less than 3 centimeters, no JVD present. Turning your head to the right. Less than 3 centimeters, no JVD present. Okay. Hand sensation. I'm going to palpate the lymph nodes. So we're going to start with the preauricular, postauricular, occipital, retropharyngeal, submaxillary, submental. On the SCM muscle and behind it, this is the cervical chain, and I'm going to cut my fingers and check the supraclavicular lymph nodes. So they were non-palpable, displaying no swollenness, no signs of infection. All right, now that I'm done with that, I'm going to check the skin turgor. Skin is elastic, no tensing. All right, I'm gonna palpate over bony prominences in the arms, but first I'm going to inspect. No lesions, masses, scars, anything abnormal. Palpate over the bony prominences, no edema present. Okay, now I'm going to check for temperature. Skin is warm to the touch. Okay, go ahead and squeeze my fingers. Bilateral equal strength. Check the radial pulses. Bilaterally symmetrical radial pulses. Okay, squeeze my finger, good. Cap refill, less than 3 seconds. Less than 3 seconds. Okay, I'm gonna check range of motion. Go ahead and extend your arms out and bring them up, and flex them. Okay, good. And now from the side, bring them above your head. Okay, was there any pain associated with that? No. All right, that's great. So now that I checked everything in your arm, I'm going to ask you to wait while I grab my reflex hammer. My reflex hammer. 1 second, sir. Okay, sanitize the reflex hammer. And I'm gonna check your brachioradialis reflex, tendon reflex. So I'm gonna place my thumb on the antecubital region using the small side of the reflex hammer. I'm gonna strike the tendon and see flexion. Placing the thumb on the antecubital region, strike the tendon and flexion. Okay, and while we're here, I'm gonna ask you to dangle your feet over, and I'm going to check for patellar tendon reflex. I'm going to strike under the kneecap at the patellar tendon, flexion, flexion. Okay, I'm going to get my auscultation equipment and we'll be right back, sir. Okay, so now I'm going to auscultate your carotid artery in between the trachea and sternocleidomastoid muscle for 15 seconds. Can you please hold your breath using the bell of my stethoscope after I sanitized it? Okay. No bruits were present. Now I'm going to palpate. +2, +2. Check for radial carotid symmetry. Okay. All right, since this touched, sanitize. All right, now I'm gonna listen to the heart sounds. We're gonna do the second intercostal space, right sternal border, the aortic valve, where S2 is louder than S1. Second intercostal space, left sternal border, pulmonic valve, S2 is louder than S1. We're gonna go to Erb's point using the bell. S1 is equal to S2. And then we're gonna do the fourth intercostal space, left sternal border, tricuspid valve, S1 is louder than S2, and the left midclavicular line, fifth intercostal space, mitral valve, S1 is louder than S2. And now I'm going to ask the patient to lean forward, please, and take their pulse for 60 seconds for the apical pulse. Pulse was recorded at 60 beats per minute. All right, so now I'm going to assess lungs. So first I'm going to inspect. No barrel chest is present, skin is intact. Okay, so when I place the diaphragm on your chest, go ahead and take a deep breath for me, okay? Breath sound clear, 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 breath sound clear. Okay, on the right side, mid-axillary line, and in between the fourth to sixth intercostal space, I'm gonna assess for the lateral lateral breath sound. Clear, okay. Now on the back, we're gonna inspect any masses, lesions, scars, anything of that nature. Okay, now I'm going to put this down and ask you to take a deep breath. All right, bilateral expansion symmetrical. Okay, now I'm going to use the diaphragm and I'm going to wipe it down since I touched my leg. We'll go avoiding the scapula. Clear, 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 and clear. Rate and rhythm, breath sounds were clear, everything sounded great. Okay, so now I'm going to ask the patient to lay down for me, please, in a supine position. Okay, I'm going to inspect. Belly is slightly rounded and no masses, lesion scars, temperature is warm, no skin tensing. Okay, now that we inspected, we're going to auscultate, sanitize, left lower quadrant, right lower quadrant, 15 seconds, right upper quadrant, 15 seconds, left upper quadrant, 15 seconds, left lower quadrant, 15 seconds. Heard about 16 to 20 gurgles per minute. And now I'm going to percuss for tympany. Tympanic, 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 tympanic. If the patient recently ate, their stomach may be full and it could produce a dull sound. Okay, percuss. Now I'm going to palpate. No pain. Tell me if there's any pain, sir. No pain, no pain, no pain, no pain. So there's no rebound tenderness, no pain. Go ahead and sanitize, and we're gonna listen for the left of the midline. We're gonna listen for bruits using the bell. 15 seconds, 15 seconds, 15 seconds. Okay, no bruits were present. Take this off. Okay. Alright. Gonna inspect the legs now. No masses, lesions, scars, skin is intact. Palpate popliteal pulse. Palpate the dorsalis pedis pulse. Okay, put finger over bony prominences for any edema. No edema. No edema was present. Okay, I'm gonna check cap refill now. Less than 3 seconds. Less than 3 seconds. I'm gonna check for strength. So go ahead and push when I pull. Okay, now go ahead and pull when I push. There you go. Bilateral strength equal, and pulses were also symmetrical. Okay, now I'm going to ask the patient to do range of motion checks. So just go ahead and wiggle your ankles like this. Okay, good. Did any pain with that? No? All right, now go ahead and bring your knees to your chest, please. Good. Okay, no pain with that, right? You have no recent hip surgery or any knee trauma? No. Okay, that's good. All right. So now that I checked cap refill 2, less than 3 seconds, less than 3 seconds, great. I'm gonna ask you to stand up. All right, close your eyes, put your arms by your side, and I'm gonna do a Romberg test for 20-30 seconds. Close your eyes and put your arms by your side. Okay, patient had good balance, did not fall. Okay, now go ahead and walk 5 feet forward and 5 feet backwards. Patient's gait and balance were normal and proficient. Okay, now I'm gonna check your upper cerebellar response by asking you to do this repetitive motion on your knees or thighs. Good, and now your lower cerebellar response by asking you to strike your back of your heel up your shin towards your knee. Okay. That concludes my assessment. Have a good day.